Welcome to SSR Pharma Media, your trusted source for pharma knowledge. HAP Exam Edge Series, MCQs for Success, Human Anatomy and Physiology. Today we are going to discuss about urinary system. Prepare, practice, succeed. So urinary system we are going to discuss. So in that anatomy of urinary system, micturition is the process of urination and disease of urinary system we are going to discuss. The first question, the kidney in human is shaped like option A spherical shape, option B bean shape, option C oval shape, option D triangular shape. So the answer is option B. It is a bean shape. So kidney is a bean shape. Human kidneys are typically bean shaped with concave medial border and convex lateral border. Next, at which vertebral level do kidneys lies? Option A, thoracic 5 to thoracic 7. Option B, thoracic 9 to lumbar 2. Option C, thoracic 12 to lumbar 3. Option D, lumbar 3 to lumbar 5. So the answer is option C. Thoracic 12 to lumbar 3 is the answer. Kidney extend from thoracic 12 to lumbar 3 vertebrae. The right kidney is slightly lower than left. So right kidney is slightly lower than left. Next, the superior pole of the kidney is related to which gland? Option A, pituitary gland. Option B, thyroid gland. Option C, adrenal gland. Option D, pancreas. So the answer is option C, adrenal gland. So each kidney's superior pole is capped by an adrenal gland. So it's the adrenal gland capped on the kidney. That means present above the kidney. Next, which of the following is the functional unit of the kidney? Option A, nephron. Option B, glomerulus. Option C, loop of Henle. Option D, collecting duct. So answer is option A, nephron. So this is the nephron, structure of nephron. The nephron is the structural and functional unit of the kidney. So responsible for the filtrations, reabsorption, secretions and urine formation. Glomerulus, it's the part of the kidneys are glomerulus, loop of Henle and collecting ducts are components of the nephron. Parts of the nephron. These are all parts of the nephron or components of the nephron. So which artery supplies blood directly to glomerulus? Option A, renal artery. Option B, afferent arterioles. Option C, efferent arterioles. Option D, interlobar artery. So the answer is option B, afferent arterioles. So the afferent arterioles carries blood to the glomerulus where filtration occurs. The efferent arterioles drains blood away from the glomerulus. So afferent means arrives, efferent means exit. So A for arrives and E for exit. So the blood supply in the sense of blood supply. So blood supply afferent means arriving inside the glomerulus. Efferent means it's going out of the glomerulus. Next, which part of the nephron is primarily responsible for reabsorption of glucose and amino acids? Option A, distal convoluted tubule. Option B, loop of Henle. Option C, proximal convoluted tubule. Option D, collecting duct. So the answer is option C, proximal convoluted tubule. So nearly all glucose, amino acids and the majority of ions and waters are reabsorbed in the proximal convoluted tubule. So this is a proximal convoluted tubule. So here only the absorptions of water, ions, amino acid, glucose are takes place. Next, the 100% of glucose is normally reabsorbed in option A, loop of Henle, option B, distal convoluted tubule, option C, collecting duct, option D, proximal convoluted tubule. So the answer is option D, proximal convoluted tubule. So here only the 100% of glucose is absorbed. Proximal convoluted tube absorb all glucose and amino acids under normal conditions. Next, the loop of Henle mainly function in option A, filtration of plasma, option B, concentration of urine, option C, excretion of urea, option D, reabsorption of glucose. So the answer is option B, concentration of urine. The loop of Henle creates a counter current mechanism that allows kidney to concentrate urine by reabsorbing water and sodium. So this is a proximal convoluted tube. So here only the this is the descending loop. So here only the counter current loop of Henle, this is called loop of Henle. The counter current mechanisms takes place in this loop of Henle. Which structures directly connects the kidney to the urinary bladder? Option A, urethra, option B, ureter, option C, collecting duct, option D, renal pelvis. So the answer is option B, ureter. So the ureters are muscular tube that transport urine from renal pelvis of each kidney. So renal pelvis of each kidney to the urinary bladder. So this part is called ureter. So it's connecting to the urinary bladder. Next, which part of the nephron is impermeable to water? Option A, proximal tube. Option B, descending limb of loop of Henle. Option C, ascending limb of loop of Henle. Option D, collecting duct. So answer is option C, ascending. This is a ascending. This part is ascending limb of loop of Henle. It is the thick ascending limb of the loop of Henle is impermeable to water but actively reabsorb ions, crucial for urine concentration. Next, the the trigone of the urinary bladder is formed by opening of option A, 2 ureters and urethra, 2 urethrae and 1 ureter. Option C, 1 ureter and 2 urethrae. Option D, internal sphincter muscles. So the answer is option A, 2 ureters and urethra. 2 ureters and urethra. The trigone is a triangular region in the bladder defined by 2 ureteric orifices and the internal urethral orifice. Jutaglomerular cells are mainly responsible for secreting option A, aldosterone, option B, renin, option C, angiotensin 2, option D, erythropoietin. So the answer is option B, renin. So jutaglomerular cells is in the different arterioles secretes renin, which regulates blood pressure via renin angiotensin and aldosterone system. Next, which hormone increases water reabsorption in the collecting ducts? Option A, aldosterone, Option B, vasopressin. Option C, renin. Option D, angiotensin 2. So the answer is option B, vasopressin. So antidiuretic hormone, ADH. So antidiuretic hormone increases the permeability of collecting ducts to water by inserting aquaporin channels and leading to concentrated urine. Aldosterone mainly acts on the option A, glomerulus, option B, PCT, option B, proximal convoluted tube, distal convoluted tube DCT, and D, loop of Henle. So the answer is option C. So DCT. Aldosterone increases sodium reabsorption and potassium excretion in the distal convoluted tubule. Next, the micturition reflex is primarily controlled by option A, hypothalamus, option B, pons, option D, medulla oblongata, option D, cerebellum. So the answer is option B, pons. So the Pontine Micturition Center, it is also called Pontine Micturition Center, coordinates relaxation of the urethral sphincter with contractions of decussor muscles for urination. The higher centers provides voluntary controls. So decussor muscles. In infants, micturition is mainly option A, voluntary act controlled by cortex. Option B, a spinal reflex without cortical control. Option C, controlled by hypothalamus. Option D, absent until 2 years. So the answer is option B, a spinal reflex without cortical control. So in infants, micturition occurs via spinal reflex pathway. Voluntary cortical controls develops with the age 2 to 3 years. Next, the pigment responsible for the yellow color of urine is option A, bilirubin, option B, urochrome, option C, hemoglobin, option D, uric acid. So the answer is option B, urochrome. So urochrome derived from the hemoglobin breakdown gives urine its normal pale yellow color. The most common causes of urinary tract infection UTI is option A, Staphylococcus aureus, option B, Escherichia coli, option C, Klebsiella pneumonia, option D, Pseudomonas aeruginosa. So the answer is option B, Escherichia coli. So that means E. coli accounts for 70 to 30% of UTI is due to its ability to adhere to uroepithelial cells via fimbriae. Next, proteinuria is the most commonly a result of damage to option A, proximal tubule, option B, loop of Henle, option C, glomerular filtration barrier, option D, collecting duct. So the answer is option C, glomerular filtration barrier. It is normally proteins are not filtrated. Glomerular damage leads to proteinuria. Next, in nephrotic syndrome, which feature is not typically seen? If you like this video, please like, share and subscribe. Option A, massive proteinuria. Option B, hypoalbuminemia. Option C, generalized edema. Option D, hematuria. So the answer is option D. Hematuria. So it is a nephrotic syndrome, is characterized by proteinuria, hypoalbuminemia and edema and hyperlipidemia. The hematuria is most typical of nephrotic syndrome. Next, the most common type of kidney stone, so renal calculus, is composed of option A uric acid, option B calcium oxalate, option C magnesium ammonium phosphate, option D cysteine. So the answer is option B calcium oxalate. So calcium oxalate stones are most frequent and its risk factor dehydration, hyperparathyroidism, excess oxalate intake. Next, which clinical test is used to detect urinary tract infection? Option A Benedict test, option B Rothra test, option C nitrate test, option D Fegling test. So the answer is option C nitrate test. Many bacteria convert urinary nitrates to nitrites. It gives positive nitrate test indicate UTI, urinary tract infection. Next, which part of the nephron is primarily responsible for acid-base regulation? So, hydrogen ion secretions and bicarbonate ion reabsorption. Option A, glomerulus. Option B, loop of Henle. Option C, proximal tubule and distal tube. Option D, collecting ducts only. So, tell in the comment box. So, all of you join in our WhatsApp community. You will get hands out material and test series. So, thank you. Like, subscribe and share.